Hello everyone, welcome back to the channel. Today we're diving deep into paralysis attacks, understanding everything from causes to treatments. We'll uncover the science behind this condition, discuss its impact on your life, and explore ways to manage it. We'll also cover the latest research to keep you informed. So, whether you're familiar with paralysis or just curious to learn more, stick around for this informative session. Let's get started. Paralysis, in its simplest terms, is the loss of muscle function in one or more parts of your body. Imagine your brain sending signals through your nerves, like messages traveling on tiny wires, telling your muscles to move. Now, picture something disrupting those signals, like a roadblock on those wires. That's what happens during paralysis. The messages get blocked, and your muscles don't receive the instructions to move. It's like your body's own communication system experiencing a glitch. Now, when we talk about a paralysis attack, we're often referring to a sudden onset of these symptoms. It's not a gradual weakening. It's like someone flipped a switch, and suddenly you're experiencing this loss of control. It can be incredibly frightening, both for the person experiencing it and for those around them. The impact of paralysis on the body can be significant, affecting not just your ability to move, but also your daily life. Imagine not being able to walk, hold a cup of coffee, or even speak properly. These are the harsh realities that individuals with paralysis often face. But here's the important thing to remember. Paralysis doesn't have to define you. With the right knowledge, support, and treatment, it's possible to manage the condition and live a fulfilling life. Now, let's unravel the mystery behind what triggers these paralysis attacks. One major culprit is stroke. Imagine a blockage in the blood vessels supplying your brain, cutting off vital oxygen and nutrients. This can damage brain cells responsible for controlling movement, leading to paralysis. But it's not just strokes we need to be aware of. Spinal cord injuries are another significant cause. Think of the spinal cord as the main highway for nerve signals traveling between your brain and the rest of your body. An injury to this highway, like from a car accident or a fall, can disrupt those signals, resulting in paralysis. Nerve disorders, like multiple sclerosis, MS, are like saboteurs slowly damaging the protective covering of your nerves, called myelin. This damage disrupts nerve signals, leading to weakness and paralysis over time. Infections, those pesky invaders, can also play a role. Conditions like meningitis and encephalitis can inflame the brain and spinal cord, interfering with nerve function and potentially causing paralysis. And let's not forget about autoimmune diseases. These occur when your immune system, which normally protects you, mistakenly attacks your own body. In conditions like Guillain-Barré syndrome, the immune system attacks the nerves, leading to muscle weakness and paralysis. These are just a few of the potential causes, and it's important to remember that each case is unique. If you're experiencing any symptoms of paralysis, seeking medical attention immediately is crucial for proper diagnosis and treatment. Recognizing the signs of a paralysis attack is crucial, as early intervention can significantly impact outcomes. One of the most obvious symptoms is muscle weakness, which can range from a mild tingling sensation to complete inability to move a limb. Imagine feeling like your arm or leg is filled with lead, making it difficult to lift or control. Numbness or a lack of sensation in the affected area is another red flag. It's like that part of your body has fallen asleep, but it doesn't wake up. This loss of feeling can make it challenging to coordinate movements or even realize you've injured yourself. Sudden difficulty speaking, often called slurred speech, can also signal a paralysis attack. Imagine your words getting jumbled up, making it hard for others to understand you. This can be incredibly frustrating, especially in emergency situations. Vision problems, such as double vision, blurred vision, or even loss of vision, can also occur. Imagine the world suddenly becoming blurry, or seeing two of everything. This can make it dangerous to navigate your surroundings. Dizziness, loss of balance, and difficulty walking are additional warning signs. Imagine feeling unsteady on your feet, like the room is spinning. This can increase your risk of falls and injuries. Severe headaches, especially those that come on suddenly and are accompanied by other symptoms, should never be ignored. Imagine a sharp throbbing pain in your head that won't go away. This could be a sign of a serious underlying condition. Loss of bladder or bowel control can also occur in some cases. Imagine the embarrassment and discomfort of losing control over these bodily functions. Paralysis isn't a one-size-fits-all condition. It manifests in different forms, each with its own set of characteristics. One way to classify paralysis is by the extent of the body affected. Localized paralysis, as the name suggests, affects a specific area, like your face, hand, or foot. It's like a targeted disruption, leaving other parts of your body functioning normally. On the other hand, generalized paralysis is more widespread, affecting larger areas of the body. This can include one side of the body, known as hemiplegia, both legs, which is called paraplegia, or all four limbs, referred to as quadriplegia. The impact on daily life is understandably more significant with generalized paralysis. Another way to categorize paralysis is by the underlying cause. For instance, stroke-induced paralysis often affects one side of the body, while spinal cord injuries typically result in paralysis below the level of the injury. Understanding these distinctions helps tailor treatment strategies. It's important to note that paralysis can also be temporary or permanent. Temporary paralysis, also known as transient paralysis, can occur after a seizure or as a symptom of conditions like Bell's palsy. While unsettling, the good news is that function often returns within hours or days. Permanent paralysis, however, is long-lasting and requires ongoing management. This doesn't mean life comes to a standstill, but it does necessitate adaptations and support to maintain quality of life. Diagnosing the root cause of paralysis is like detective work, involving a series of tests and examinations to pinpoint the culprit. Your doctor will start by taking a detailed medical history, asking about your symptoms, past medical conditions, family history, and any recent injuries or illnesses. This conversation is crucial in guiding further investigations. A physical exam is the next step, where your doctor will assess your muscle strength, reflexes, sensation, coordination, and balance. They'll be looking for any abnormalities that could point towards the underlying cause of your paralysis. Imaging tests, such as CT scans or MRI scans, provide detailed pictures of your brain, spinal cord, and nerves. These scans can reveal strokes, tumors, spinal cord injuries, or other structural abnormalities that could be compressing nerves and causing paralysis. Electrodiagnostic tests, like electromyography, EMG, and nerve conduction studies, measure the electrical activity in your muscles and nerves. These tests help determine if the paralysis is due to a problem with the nerves themselves or with the muscles they control. Blood tests may also be ordered to check for infections, inflammation, autoimmune disorders, or other conditions that could be contributing to your paralysis. These tests provide valuable clues about your overall health and help rule out certain causes. Lumbar puncture, also known as a spinal tap, involves collecting a small sample of cerebrospinal fluid, CSF, from your lower back. This fluid surrounds your brain and spinal cord, and analyzing it can help diagnose infections, inflammation, or other conditions affecting the nervous system. Treating paralysis is not a one-size-fits-all approach. It depends on the underlying cause, the severity of the paralysis, and the individual's overall health. The primary goal of treatment is to address the root cause if possible, to prevent further damage and promote recovery. Medications play a crucial role in managing paralysis. For example, in the case of a stroke, clot-busting drugs or blood thinners might be administered to restore blood flow to the brain and minimize damage. Corticosteroids can help reduce inflammation in conditions like Guillain-Barré syndrome. Physical therapy is a cornerstone of paralysis treatment, focusing on maintaining muscle strength, flexibility, and range of motion. Therapists work with patients to improve mobility, regain independence in daily activities, and prevent muscle atrophy. Occupational therapy helps individuals adapt to their environment and regain skills needed for daily living. This might involve using assistive devices, modifying the home or workplace, or learning new ways to perform tasks. Speech therapy is beneficial for those experiencing speech or swallowing difficulties due to paralysis. Therapists work with patients to improve articulation, voice strength, and swallowing coordination. In some cases, surgery might be necessary to relieve pressure on the spinal cord, repair damaged nerves, or address other structural issues contributing to paralysis. The decision for surgery is made on a case-by-case basis, considering the potential benefits and risks. While it's crucial to consult a healthcare professional for diagnosis and treatment of paralysis, incorporating certain home remedies can complement medical interventions and support your overall well-being. Maintaining a healthy diet rich in fruits, vegetables, whole grains, and lean proteins provides your body with essential nutrients to support nerve health and overall recovery. Think of it as fueling your body with the building blocks it needs to repair and regenerate. Staying hydrated is equally important, as water plays a vital role in nerve function and overall bodily processes. Aim to drink plenty of water throughout the day, especially if you're undergoing physical therapy or other treatments that might dehydrate you. Gentle exercises, as advised by your physical therapist, can help maintain muscle strength, flexibility, and range of motion. These exercises should be tailored to your specific needs and abilities, gradually increasing in intensity as you progress. Getting enough rest is crucial for your body to heal and recover. Create a relaxing bedtime routine. Ensure your bedroom is dark, quiet, and cool, and aim for 7 to 9 hours of quality sleep each night. Managing stress is essential, as stress can worsen paralysis symptoms and hinder recovery. Explore stress-reducing techniques like deep breathing exercises, meditation, yoga, or spending time in nature. That was a deep dive into the world of paralysis, exploring its causes, symptoms, types, diagnosis, and treatment options. Remember, if you suspect a paralysis attack, it's important to consult a healthcare professional immediately. Early intervention is key to improving outcomes and managing this condition effectively. Don't forget to like, subscribe, and share this video for more health-related content. Stay healthy and informed.